Hello everyone, welcome back to Exam 3.0 Dentistry. So today we are going to discuss a very interesting condition from pediatric dentistry, that is the Riga-Fede Syndrome. So before we start, let me ask you a question. Imagine a newborn baby has a tooth that has already erupted. During the feeding, the baby tongue repeatedly rubs against that tooth and an ulcer develops on the tongue. So what do you think is this condition called? Yes, the answer is Riga-Fede Syndrome. So in today's lecture, we will understand what is Riga-Fede Syndrome, what causes it, where does the ulcer occur, what are its clinical features, how is it diagnosed, what are the histopathological findings, and finally how do we treat it. So let's understand it step by step. So Riga-Fede syndrome, it is an oral condition which is found mainly in newborn. So it presents as an ulceration commonly on the ventral surface of the tongue and on the inner surface of the lower lip. Now what is the main cause? So here the ulcer is produced because the soft tissue is repeatedly traumatized by the erupting baby teeth. So in simple words, baby tooth causing the repeated rubbing, which lead to soft tissue trauma and result into ulcer. Okay. So here the condition can also be described as a sublingual traumatic ulceration. But remember one important point. Although it starts as an ulcer, if the trauma continues repeatedly, the lesions may become larger and can develop into the fibrous mass. So students, remember the sequence. Trauma cause ulcer and repeated trauma resulting into fibrous mass. Okay. So Riga-Fede syndrome is seen in children which is less than 2 years old. So question for you, if the trauma is stopped early, do you think the lesion will continue to enlarge? The answer is no. Removing or reducing the traumatic factor is the important part of the management. Okay. Now let's understand what is happening in this diagram. So look carefully at the lower front tooth. Okay, so here the baby tongue is positioning close to these teeth, and during the feeding, the baby naturally moves the tongue forward, and because the tooth is sharp or prominent, the tongue repeatedly comes into contact with it. So every time the baby feed, the tongue moves forward, contacts the tooth, friction occur and tissue get injured. So if this happens repeatedly, an ulcer will develop. So this is an ulcer which is developed on the ventral surface of the tongue. So which structure is receiving repeated trauma? Yes, that is a soft tissue, especially the ventral surface of the tongue. And which teeth are commonly responsible? The answer is lower front teeth. So this is why the position of the lesion is very important in recognizing the Riga-Fede syndrome. Okay. Now let's move to the cause. So here Riga-Fede syndrome is very rare. So here the basic mechanism is repeating rubbing of the tongue over the teeth, usually from the lower front teeth, and is most commonly associated with the natal teeth as newborn baby pushes the tongue forward when feeding. Okay. So what are natal teeth? Natal teeth are teeth that are present in birth. And what are neonatal teeth? They are teeth that erupt during the first month of life. And in these babies, the tongue is pushed forward during the feeding. Therefore, the tongue repeatedly comes into the contact with the lower anterior teeth. And these repeated trauma produce the ulcer. Okay. So simple example, like imagine you have a sharp edge repeating rubbing against your skin. What will happen? First irritation, then injury, and eventually an ulcer or wound may develop. So here the same basic mechanism occur here. Okay. And it also develops in elder babies when their lower front teeth erupt at the normal time. So the condition is not restricted only to the newborns. It can also develop in older babies when the lower front teeth erupt at the normal time. So remember this point. In newborn, it was due to the natal and neonatal teeth. And in older baby, it was due to like normally erupting lower anterior teeth. So both can produce repeated trauma. Okay. So now this is a very important slide for examination. So let's understand each one by one. That is the clinical features. So lesion usually affecting the ventral surface of the tongue and the lips. So why is the ventral surface commonly affecting? Because it repeatedly comes into the contact with the lower anterior teeth and during the feeding. Okay. Less commonly, the top of the tongue is involved due to the repeated contact with the upper front teeth. So it shows that the top of the tongue can be involved, but this is less common because of the repeated contact with the upper front teeth. So here, the lower anterior teeth commonly on the ventral tongue. It caused commonly on the ventral tongue, while the upper anterior teeth less commonly top of tongue. Okay. I hope now you understand. Okay, so can the cheek be affecting? The answer is yes. Cheeks may also be affecting due to the repeated biting. So don't think the lesion is limited only to the tongue. So how does the lesion look? So here the lesion begin as an ulcer. The base of the ulcer can be covered by a yellowish fibrinopurulent membrane that can be whipped off, and around the ulcer we can see redness, raised white edges which is immediately next to the ulcer, and the lesion can be painful. So question for you. So if you see a painful ulcer in a baby exactly at the site which is repeatedly traumatized by an erupting tooth, so what should come to your mind? That is a Riga-Fede Syndrome. Okay. This is all you already see. That is, first we have to identify the ulcer. Now look at this location. Is it on the ventral surface of the tongue? If yes, then think about the trauma from the lower anterior teeth. Now look at the surrounding area. You may notice that is the redness around the ulcer and the raised white margins. The ulcer may also have a yellowish purulent covering. Now look at the nearby erupting tooth. If the tooth is repeatedly contacting the ulcerating area, the diagnosis become much easier to suspect. Okay. Now let's talk about the diagnosis. So here the biopsy may be performed to exclude other conditions affecting the tongue, particularly when the lesion persists. So it should be considered that persists for 2 weeks after removing the suspecting cause. So why do we need to think about the other condition? Because an ulcer on the tongue is not always the Riga-Fede syndrome. Other possibilities include like infection, which include bacteria, viral or can be fungal infection. Second one is malignancy. So it can be lymphoma or the sarcoma. So why should we perform a biopsy? Not simply because every Riga-Fede lesion need a biopsy. Here the purpose is to exclude the other conditions, especially when the lesion persists despite removal of suspecting traumatic cause. Now let's move to the histopathology. So this is another important exam area. So it describes that the Riga-Fede syndrome as a cause of the eosinophilic ulcer. A typical histological granuloma may also be seen. And so histological sections show as ulcerative surface with underlying mixed inflammatory cell, which is include lymphocyte, macrophages, mast cell and eosinophil, which is very more in number. That's why we call it as the eosinophilic ulcer. Okay. So this is a diagram of the histopathology. So this is an ulcerative surface, and beneath this ulcerative surface there is more inflammatory infiltrate. So it is include lymphocytes. It includes lymphocyte, macrophages, mast cell, and eosinophil. More eosinophils you will see. There is numerous eosinophil. Okay. Now comes the final and very important part, that is the treatment. The main idea is simple, that is remove or reduce the trauma. Okay. So it includes several conservative treatments. So first one is smoothing the rough edges of the teeth. So if the tooth has a rough or sharp edge that is repeatedly injured the tissue, so we can smooth the rough edge. Think about like this. If there is sharp edge, then it can cause trauma. If there is smooth edge, that means less trauma. Okay. Now the second option is protecting covering of the tooth. So here it means using the rounding. So using the rounding smooth composite resin. So this create a smooth surface and reducing the direct trauma. Okay. So what is the purpose of the composite resin? Not to remove the tooth. Its purpose is to protect the traumatized soft tissue by creating a soft surface. Okay. So with rounding smooth composite resin, we protecting the teeth. Now the third option is that is a changing of the feeding method. So here the objective is to reduce the traumatic trauma to the affecting area by changing the feeding method. Okay. Now the next one is topical cortisone application to the ulcer. So this is also another treatment. Now the last one is excision of the lesion. So this can also be considered when the lesion has progressed or required the removal. Okay. So this is a cortisone ointment and changing of the feeding method. So student, let's revise Riga-Fede syndrome in just a few seconds. I will ask you question and you answer. Question 1. Is Riga-Fede syndrome common or rare? The answer is rare. Who is commonly affecting? The answer is newborn and young children, particularly those under the 2 years. Question number 3. What caused it? The answer is repeating trauma from the erupting teeth. Next question is which teeth are commonly involved? The answer is lower anterior teeth. Which area of the tongue is commonly affecting? The answer is ventral surface of the tongue. What does the lesion begin as? It begins as a ulcer. What may cover the ulcer? A yellow fibrinopurulent membrane covers the ulcer. Next question is which inflammatory cell are seen in histologically? The answer is lymphocyte, macrophages, mast cell, and eosinophil. What is an important histological term? That is the eosinophilic ulcer. What is the basic principle of treatment? That is to remove or reduce the source of the trauma. Okay. So student, today we learn about the Riga-Fede syndrome, a traumatic ulcerative condition which is seen mainly in newborn and young children. And the most important thing to remember is repeated trauma from erupting teeth produce an ulcer, commonly on the ventral surface of the tongue. If you are preparing for your BDS exam, so remember the combination newborn plus natal or neonatal tooth plus tongue ulcer, it means Riga-Fede syndrome. If you found this lecture helpful, then don't forget to like the video, subscribe to Exam Key Point Dentistry and share with your BDS friend. I will see you in the next lecture. Until then, keep learning, keep revising and keep dentistry easy.